This teachable moment is brought to you by the Jewish Healthcare Foundation and the Pittsburgh Regional Health Initiative. With the goal of reducing inappropriate inductions, learn how a team from McGee Women's Hospital of UPMC in Pittsburgh improved this process.
The problem we were seeing in our Women Care Birth Center was related primarily to efficiencies, timeliness of getting patients into particularly our cesarean section area. And so we knew that we had a lot of inefficiencies that were making patient flow more difficult than it needed to be, which was affecting both patient and staff satisfaction.
Here at McGee, we've experienced growing volumes over the last several years, about 500 to 600 deliveries every year increasing, without increasing our facility.
She's been waiting at home for 4 hours.
I know, she called me.
I mean, she
and
called
I talked
me.
to her.
I mean,
I know.
what am I going to do? So, I mean,
I'm doing the best I can.
So the staff really bought into this early in the game because they knew it had to improve their basic lot, and they were quite anxious and willing to help us.
Part of the problem previously with scheduling our inductions is that we were asking for a Bishop score, but not necessarily getting that on every patient. Our new process requires a Bishop score. Perfecting patient care teaches us to approach this problem by looking at standardized processes so that there's not deviation from one person to the next in different situations, so that we have the most streamlined, consistent processes possible.
One of the process changes that we put in place related to this is we use a pull system where we actually call the patients and have them come in for their induction rather than just showing up. We were seeing approximately 9% of our deliveries were elective inductions. We're now down around between 3 and 6%. More importantly, what we've seen is a decrease in our cesarean section rate. We were averaging in the mid-20s on first-time mothers. We're now down around 14%. We had about 12% of our babies were being induced before 39 weeks gestation. We were now down under 3%. Those are the patient safety items. In addition to the improved quality, patient satisfaction, staff satisfaction, all very important components of this program.